Today we have a distinguished doctor, a young doctor, a dynamic person who had come to discuss about allergy immunological disorders. Now, allergy immunological disorders, fortunately or unfortunately, there are doctors who are coming up now, but we commonly discussed about one criteria, that in MBBS education there is a necessity that there is a training to be implemented at the undergraduate level for understanding about the immunological manifestations of each and every organ. Because the moment we complete the MBBS, a person enters orthopedics, or his choice of say microbiology or biochemistry or gastroenterology and super specialty or dermatology or pulmonology, any PG course or super specialty course, he carries with him the organ based treatment. The problem is immunology is a software. When you consider the body divided into software and hardware, the body organs are the hardware. And what connects all these things is a software called immunology. The cells randomly move here and there. We all know that blood circulation is there everywhere in the body. Same way, the cells keep moving from top to the bottom. Same way, the immune cells move from each organ to other major organs of the body. For a simple example, like gut-lungs and gut-lung axis or gut-brain axis or anything. Now let's go and talk to the young dynamic doctor who is also shortly going to US for his further education system. Hello, Dr. Murthy garu. Namaste.
Namaste.
Nice having you here, sir. What just we were discussing regarding the medical age, what is your opinion? Because a lot of doctors fail to understand the basics of immunological systems once they land up into organ-based specialty. What is your opinion, sir?
My medical school I started in 2015 and I graduated in 2022. So during this 5.5 years of my medical school, the main thing I learned about the allergy and immunology is about anaphylaxis and anaphylaxis only. And that is because that is obviously the most severe and patients unfortunately pass away due to anaphylaxis. But
even that understanding is not there in the patients. Because what in India we have an understanding of cancer or cardiac arrest.
That is true.
Anaphylaxis, the subject knowledge is zero. Yeah, please continue, sir.
And the reasons are, I believe, twofold, I guess. One from the patient, from the doctor side, one from the patient side. The first patients, more often than not, patients will be like chalta hai. The attitude of it's okay, it will subside, and
not taking it seriously.
Not taking it seriously, and most of the time it does go down. It's not like everyone who gets an allergy is anaphylactic.
Correct.
And so once in a blue moon it happens and nothing else, you take one tablet and it's gone, then usually people don't worry about it, and one day it will bite them in the back again. And if you talk about...
No, that comes as a shocker to them.
Yeah, that is true. And they... I don't know if it's common or no, but they end up blaming the doctor once again.
True, very true, right.
And if you are talking about medical students, the way we, at least the current medical education system in India is based on, I'd say, memorization, to be honest.
True, very true. And going for the competitive exams.
Yeah. So, if a young doctor or a medical student expresses an interest in a subject, in a particular subject, one thing is they don't have time and they don't have the resources devoted to, cultivating the interest, whatever is there. And these allergy and immunology, to be honest, it's a very complicated subject. The first time I studied it, it was during my USMLE preparation, and it blew my mind. Like one small molecule, the cascading effect of it all throughout the body. It's
very true. Very true. A small bullet kills so many in a movie.
Exactly.
Like that. A cytokine can create it can change the story totally. Yeah, please.
Exactly. And professors, they do know everything, they can explain, but the thing is, again, there's no time. And if a student asks the professor something and they say, come to my room later, the later usually never comes. So,
you have told rightly what exactly happens in the case scenario in a medical college, right? Yeah. How do you feel once now you have come to us? We spoke at length. I was thrilled to talk about the entire like Vishwarupa of in a nutshell.
Yeah.
What exactly you felt after listening? Is it necessary for every patient to be aware of all these things, or it is just academic that we should close it in the academic books? A clinical application point of it, patient-oriented, patient benefit aspect. Could you please explain that? Because a lot of people say we are taking 1 hour for the patient to explain because they don't understand. When you go to a cardiologist, 10 minutes, 13 minutes, the things are done and you know what is happening.
Yeah.
But in allergy and immunology, we need to really dig from 3 generations.
That is true.
Now, unless and until I don't have any kind of a gadget where I can just keep a screen and say, yeah, this value is there, this value is there, this value, it can connect your gut, it can connect your brain, it can connect any part of the body. Now, how do you feel after the interaction, sir?
I believe the patients, they need not have as in-depth knowledge or discussion as we had, but they should at least know how to recognize an allergy if they have one, the first thing. And then at what point they should go seek a medical attention in a hospital, or they can just take a tablet and next day go see a doctor.
Specialist, yeah.
Or a doctor or a specialist.
Yeah.
But unfortunately, the reality in India is, once again, as we discussed before, it is non-existent in a nutshell.
Correct.
But yeah, I believe good patient education is one of the first thing you have to do during a doctor-patient interaction. Yeah.
Correct.
And taking 1 hour or taking 2 hours if it's required is, I think, cornerstone for that.
Absolutely, really hits the bullseye. That's what we say. The treatment of allergy is not from the gadgets. The treatment of allergy is not from any test. The treatment of allergy comes with the interaction with the patients, because the cornerstone of any clinical subject is interaction with the patient. We should never leave the fundamentals. The more you interact clinically with the patient, the more knowledge you get. And in immunology, that is the change, that is the game changer for everything. That's what we just had with a young doctor. So how do you feel after visiting our center? Honest, very honest statement. Subject to the reports or whatever it is or the interaction. Please be honest, sir. We'll take it constructive.
It was painless, the first thing. The interest was easy to find, and I was able to get an appointment very easily and very quickly. And
did you use a force that telling that I'm a US doctor or anything?
No. I just messaged on WhatsApp, and then I got an appointment. Yeah. And after coming here, it was relatively painless. Because I am a doctor and I know how things go. I'm fine waiting for a while, but during my when I was waiting, I saw multiple patients who are like, for every 5 minutes they go to the reception, then talk, and then come sit down. It's
restless. Patients need patience.
Yeah, that is true.
But that is exactly the problem, sir. They don't understand that what inside this wall doctor is doing for 1 hour.
Exactly.
Now when I interacted with you, probably another 10-15 minutes more we've interacted, because we're discussing a subject which is more of depth of immunological manifestations and post-COVID complications and all that. But in general complications also, we discussed for around 30 minutes, 40 minutes.
That is true.
That's exactly what is the restlessness reason for the patient sitting. Why on the earth that I should wait for half an hour, 1 hour?
Exactly.